Hi, Allyson.
Hello.
I'm so glad that we finally get to do this.
I know.
So do you mind introducing yourself?
Yeah.
Let our listeners know a little bit more about you.
Okay. Well, my name is Allyson Lange-Sost. I am a licensed acupuncturist. I'm licensed in Florida and Georgia. I'm also a biomagnetic pairing therapist. I've been in medicine for over 30 years. I was a respiratory therapist for almost 17 years before I got into acupuncture. And we just moved up here last April from Florida, came up from Tallahassee.
Welcome.
Thank you. I've always wanted to be in the area. I've had family and friends up here my whole life, so it was always a dream of mine to come up here. And then I just happened to stumble into True Balance.
Yay,
Yeah.
Lucky us.
Thank you. Appreciate that.
I put it out to the universe for quite a while, so it was finally answered. So you said you did a respiratory therapy before you even get started with acupuncture. So what made that switch happen? Was there anything in particular that
and respiratory wasn't like my calling. It was a stepping stone for me. I knew I wanted to be in medicine and I just wasn't sure in what capacity. So I did that for a while and it was interesting and I got to work in a lot of different scenarios. I actually got in a car accident and it wasn't bad, but I knew to get to my chiropractor. And so I went to the chiropractor and was seeing her and getting massage therapy. And she looked at me and said, you should try acupuncture. I have somebody here. I had been looking for another step in my career and I just wasn't finding it. I didn't know what I wanted to do. I just knew I wanted to do something else. So I started receiving acupuncture. I've been a lifelong asthmatic and had an inhaler. I had steroids. I had a nebulizer. I was taking medication every day and just managing it. And after I started receiving acupuncture, that changed. And I needed my medication less and less. And I haven't owned an inhaler in almost 20 years now.
Oh, what a success story.
Yeah.
Wow.
So it was life-changing for me.
Yeah, absolutely.
And I thought, I've got to look into this. And I did, and the rest is history.
Wow.
Mm-hmm.
What better way to promote what you do when you say, look at me, I'm the example. So let's dive right into what you do, what you offer.
Okay.
So starting with acupuncture.
All right. So acupuncture and dry needling, which are very much the same. They're different techniques. I do fire cupping and Gua Sha. And I also offer biomagnetic pairing therapy and ionic foot detoxes.
Yeah, we are excited. Can you describe what is acupuncture?
Right. Well, acupuncture is needling specific areas along the body to elicit a response. And that can be a physical response. It can be mental, emotional too. We don't really separate the two. And the way I try to explain this to people is that the body has its own intelligence, right? It already knows what to do, or else we would have all been dead a long time ago. The symbol for that intelligence is pronounced chi. And this chi flows throughout the body on its own pathways, just like the cardiovascular system has a pathway, the nervous system has a pathway. This energy, this intelligence, this chi also has pathways along the body. We call them channels or meridians. And there are main channels and meridians that are associated with major organ systems like bladder channel, lung channel, liver channel, etc. And then there are little connecting channels along the way. And they coordinate all your body's functions. So it's up to us as acupuncturists to decide what channel do we need to tap into and what point along that channel
is the most effective
for what we're trying to do.
That sounds pretty complicated to me.
It takes a little while to, right. That's the quick answer to what is acupuncture. But yeah, it takes a long time to learn this and to learn it well and to be safe and effective.
How long does it take you?
It's a minimum of a master's. So the program I went to was over 3,200 hours. It's 10 semesters and we go back to back. So it's 40 months. So it's pretty intense.
That's an intense.
Yeah. And we have a specific number of patients we have to see. And then there are 4 national board exams.
So this is not just, a weekend course that you take and are ready to stick needles in people.
Not safely.
Right.
Not safely. Right. Yeah. No, it's intense and it's meant to be that to, keep the integrity of what it is we're doing.
Yeah, I think that's important to understand that acupuncture is a healing method that is very involved and is almost comparable to our Western medicine. It's a different approach, is that right?
Yeah, definitely. It is a medical practice in and of itself. And I feel like it complements other practices as well. One of the things that my mentor and one of the founders of the college, Dr. Hammer, would tell us is that all practices of medicine are valid and all are incomplete. So people have complex lives. Human beings are complex. Yeah. And, usually a multi-pronged approach is great. Exactly. And when you can work with the body's own intelligence and help it to do what it already wants to do anyway, I think that's great.
So that almost is like starting at the foundation and open up the body to the healing path.
Right. Yeah. Right. In a natural way.
I like that. I always did, and but I think it's important to understand that acupuncture is a very complex system and a very complex method. So it's not just, I go to the acupuncture one time and I'm fixed.
Right.
How many sessions do you recommend?
Yeah, that's the question everybody wants the answer to.
Yeah.
And it's hard to answer until I meet with that person. Mm-hmm. With me, your initial appointment is, we're going to talk about what brought you in, and then I'm going to do a head to toe assessment. And that helps me find patterns. It kind of depends on what brings you in. If pain is involved, often I recommend weekly treatments, usually 3 to 4 weeks, and then we can start backing away doing every other. Most of the time people come every other week. So it really just depends on what it is they're seeking treatment for. Mm-hmm. And I always say the number one thing is being consistent. Right next to that is frequency. Mm-hmm. Frequency is going to get you to your goals faster.
Right.
So, but it's got to make sense, for everybody.
Right, and make sense in what is your outcome, the goal of it all.
Right.
And then, of course, the financial aspect of it too. Yes. And that needs to be considered.
So your goals, your time, your money, it all needs to make sense.
Exactly.
Yeah.
Going back to, you said in the beginning, acupuncture dry needling, that this is pretty much the same thing. I know from my own experience, people come to me and say, my physical therapist, they did dry needling, and some people say that worked, and some people say it didn't work. Can you explain a little bit, is it the same as acupuncture? Is it different from acupuncture? I mean, they are using the same needles, right?
They are. So the American Medical Association has looked at this and said there is no discernible difference between dry needling and acupuncture.
Interesting.
We're both using needles, the same type of needle, and we're needling into the body to elicit a response, right? Yeah. They typically, with dry needling, it is a trigger point stimulation, and it's what we would call, most acupuncturists would call, it's a lifting and thrusting technique. So it's strong stimulation of the needle in that area, and there's no needle retention. Whereas with acupuncture, we might use that technique in a specific area, but we're also going to open up those channels, those meridians of communication, because it's rarely ever just right here, in that one spot where the trouble is. So we're going to use needles in other places and use different techniques.
Can you do dry needling?
Absolutely. I do. For a long time, I didn't call it that, but it's a term that people are familiar with.
And I almost want to say with way more experience than most physical therapists have, because you already do that as part of acupuncture.
It's part of our training. And the comparison is that any acupuncturist is going to have a minimum of a master's degree. And physical therapists, as of right now, only need 50 hours of training to do dry needling.
So I would go to an acupuncturist.
Just saying. I back that up.
So I think what really fits well into that conversation with dry needling and acupuncture, I think if we move on to Gua Sha.
Yeah, Gua Sha is a skin rubbing or skin scraping technique. It's just me going over the areas of tension or discomfort with a tool, and you create what we refer to as Sha. and it's not a bruise. And that's just a way to work that area between the skin and upper muscle layer. So we're helping to get those muscles, ligaments, and tendons to relax and release and bringing good circulation locally to the area.
So would you say that it also works with the fascia, with the connective tissue that runs through all the individual muscle tendons and all that?
Absolutely, yeah. Stimulates that, stimulates good blood and body fluid flow. So the lymph system gets stimulated through that. And when you have good circulation, then you have less pain and discomfort and better range of motion.
When would you apply Gua Sha?
I like to do Gua Sha on the neck and the traps. It's easier to work those areas with Gua Sha than it is with cupping. So Gua Sha seems to be a better choice for those areas. You can use it on the face to help get better blood flow and stimulate, again, the blood and body fluids on the face.
So do you have like hickey kind of redness there?
You can have
so
Sha on the face. So
you don't want to go on a date and just do Gua Sha before that.
Probably not. Give it a day or two.
Okay.
It kind of depends on how intense you're doing it and how much stagnation there is in the area.
Right.
So that's going to determine the amount of Sha that comes up, and then how long it stays there tells you a little bit more about circulation in general. So I always ask people to keep an eye on it and see, how long it takes for it to fade away.
Right.
But Gua Sha is very effective for that. You can use it if you have a sore throat. You can Gua Sha either side of your throat, and it does what we call releasing the exterior. So it brings everything up to the surface and releases it outward. It's good for colds and flus, for illnesses, sore throat, and just for muscle tension.
Well, and that brings us pretty much to cupping, right?
Yeah.
So I use cups as well in my treatments. I normally use the silicone cups, the flexible ones, or the plastic ones that you need a pump to create the suction. So, but you go back to the original form of cupping and you use fire cupping.
I do. And fire cupping and Gua Sha are both old home remedies. They've been done by little grandmothers all over the world for thousands of years.
Cupping does not mean that we cut the skin and draw blood.
No. You shouldn't. Yeah. It's very easy to overdo it with cupping, and a lot of people are doing it now, and some people are being taught to be aggressive. It's very easy to overdo it with cupping. And really the goal is not to create those marks.
Right.
Definitely not bleeding, not blistering, although I've seen that happen. It's never happened on my table, but I've seen others. What we're really doing is just doing the cupping. We're employing the modality, and then you observe the skin. That tells you a little bit about what's going on. If it's just a little puffy there, then the fluids are congested. If it's a little pink, that's superficial stagnation, so not deep pain. It's usually just discomfort or tension. The deeper and darker the Sha that comes up with cupping, the more significant the stagnation, and usually they have more discomfort in the area. Right. But that's not the goal. The goal is not to create the Sha. The goal is to do the cupping and observe the skin.
Interesting. But even that creates more movement in the area. It creates more range of motion, possibly. It breaks up that stagnation. It creates more space.
Yes. Again, we're working that area between the skin and upper muscle layer. So the connective tissue fascia is included with the muscles, ligaments, tendons, the lymph system. And again, there are different ways to get those muscles and ligaments to relax and release, right? And one way is through the stroking, which is typical with massage. Another way is to pinch or pull. Right. And you're actually doing both with cupping. And so, you're getting both actions in there. So again, you get those muscles, ligaments, and tendons to relax and release and bringing good circulation locally to the area. And that's what you need for a good inflammatory response, is good circulation.
Yeah, but that is often misunderstood. Inflammation is not a bad thing for the body. It's actually its natural response to any kind of interruption in their homeostasis, right?
Exactly. So again, we're just working with the body's intelligence, right? Yeah. Just guiding that chi, letting it know. Yeah. Go over here. Right. Yeah. Let it go, let it know, let it flow.
So when you do fire cupping, do you use the cups only stationary or do you move them?
A little of both. It kind of depends on the person. Again, it's very easy to overdo it with cupping. So you have to take each person individually, and sometimes I do moving or gliding cupping, and that's wonderful. That feels great. And so I typically do what's called modified flash cupping. So it's an on and off technique. I don't leave them on for very long in any particular spot. It can be overwhelming and you can pull the rug out from under somebody. So you do have to be careful with it.
Yeah.
It's a very effective modality when it's done right.
Agreed.
And it shouldn't hurt. You shouldn't be sore after cupping. You should feel better.
Exactly.
Yeah.
There should be relief.
Yes.
Yeah, I think it's so interesting. You know, sometimes people come to me, and I'm sure you have the same experience. They come with that attitude, no pain, no gain.
Right.
And I'm always a little bit cautious with that.
Yeah.
I do understand some techniques create discomfort.
Yeah.
Like Gua Sha is not always comfortable
Right.
to receive.
Right.
Or cupping, to set that cup on an area that is sensitive might not feel in the moment very comfortable. But I always feel that no matter what therapy I'm applying, by the time they walk out the door, they should feel better than when they walked in the door.
I like that approach too. I'm a pretty conservative and gentle practitioner. Some people are more aggressive. And I really try and explain to people that nothing I do should be painful. There are some areas when I'm needling you that may be more sensitive just because of where they're located. And sometimes those points are what I say active. So there may be more of a response as I needle, but it should, settle down and you should be able to relax on the table and take a little AcuNap. I find if you're relaxed on the table, the needles are going to do their job. They're just communicating with one another and coordinating and kind of helping to redirect what's going on. And if you're in a relaxed state, that's going to happen more easily. And take a little AcuNap. I give a discount for snoring.
I mean, that's the favorite part of me. I think every time I get a acupuncture treatment, it's not so much that I'm falling asleep. It's I'm in a state of in between. I'm not wide awake, but I'm not full asleep.
Right.
But after, I feel like yes, the rest of the day, or I feel refreshed. I feel relaxed.
Right. Right. And people come to me, they want more energy, and a lot of times after a treatment, they'll have a little dip in energy, and I just remind them if they'll honor that, the energy you're seeking will come.
Right.
This is just your body kind of getting ready. They say
I think
an arrow doesn't fly until the bow is pulled backwards, right? So sometimes you have to go back for just a minute, and then that energy will come.
Going back to that we are educating our clients or patients often about our wonderful innate capability of our bodies to heal themselves if given the opportunity.
Enough time in the right circumstances, our bodies will heal themselves.
Yes.
And I think a lot of times they don't get that from their medical doctors.
No.
I see people all the time, well, this is just what it is. You're just going to have to learn to live with it. And that's unfortunate because in my practice, what I've seen is that everyone gets better. Now, the degree to which they get better depends on all kinds of things, right? Where they were when they came in, what they're dealing with, what their lifestyle is. We can do great things here, but it really depends on what they do outside of here. Everyone gets better. And, if you have a question, can acupuncture help with this? The short answer is yes. Yes, it can. I had a lady that came to me. It was she had fallen at work and fractured her foot and her ankle. She had had 8 surgeries. She had done prolotherapy, she had injections, physical therapy. She had done everything that they knew to do for her, and they were going to fuse her joint, which was going to ripple into all kinds of other issues, right? When she came to me, she asked the doctor, could I try acupuncture? And said, well, sure, it's not going to hurt, but I don't have any big expectations. So she comes in, with crutches.
Oh, wow.
She either used crutches or a walker, and on a bad day, she was in a wheelchair. And even at work, just going down the hall to the bathroom, just kind of depended on what kind of day she was having. So because it was an injury at work, her doctor had to write an order for it every 6 months. And every 6 months she would go back and he would measure her range of motion. Now, I saw her for 10 years, and every 6 months she went back, her range of motion improved. And every single time he would, well, I don't expect any more changes. Well, this was good. And so that was always our joke.
Right.
Yeah. But she takes dancing lessons with her husband now.
That is amazing.
Yeah.
I mean, she got her life back.
She got her life back, 100%. So and that's the beauty of acupuncture, is that we take the whole body into consideration. And we treat the body as a whole.
I think that's a very comforting thought, that you can go to somewhere and they look at you as a complete human being and not just a leg. I think we have one big thing left, which I was completely new to that.
Yeah.
So you introduced me to that, and that's biomagnetic pairing.
Yeah.
Tell us a little bit about that.
This has been really fascinating. I started getting involved with this about 6.5 years ago. And there was a lady that would come up to Tallahassee from Tampa. And I learned through my circle of people who she was and what she was doing. So went and tried it myself and felt amazing. And brought my husband back the next time she came, and a friend of mine who actually drove down from Alpharetta to Tallahassee to see her. She has a lot of physical issues going on and was working with other practitioners up in Alpharetta who were saying, well, we'll work with one thing at a time, and it might take you several years to get through this, but we can do it. And I told her, I don't think you're going to have to work at it that long. I really don't. You need to come do this. And it changed her life. So much so that she began studying it too.
Wow.
So biomagnetic pairing therapy was discovered back in the 80s by Dr. Goiz down in Mexico, who was in the throes of HIV and tuberculosis. And he was a physical therapist who also did respiratory and acupuncture. And but in Mexico. He learned about this through a NASA scientist who was studying the astronauts when they would be out in orbit, and how they would have a leg length discrepancy when they came back. That would just correct itself after they had been back on the Earth. And he came to the conclusion that it was lack of exposure to the Earth's magnetic pole, not gravity, but the Earth's magnetic pole, that would move that leg. So they began working together, and Dr. Goiz just ran with it. And so what we're doing is, it's a manual scan. I am looking for distortions in the pH. Those distortions can come about from, it could be a genetic predisposition, it could be accident, illness, injuries. Emotions can cause distortions at the cellular level in different areas of the body. So I'm scanning the entire body. When I find an area of distortion, your leg length will change, and that lets me know that there's a distortion in that area. Then I pair that magnet with another magnet in opposite polarity, and that will help to correct the distortion in the pH. Sometimes you'll have bacteria, viruses, parasites, funguses within those areas, and we create an environment that is inhospitable to pathogens.
Right.
Most of them won't thrive, and some cannot survive. And then your body takes over and eliminates them. So those pathogens can be contributing to or causing some symptoms or conditions, diagnoses that you've been given. So by correcting the pH all over the body, we're just bringing your body back into that homeostasis, so things will function better and you won't have the disease and discomfort.
That is pretty amazing.
It's fascinating.
I still need to wrap my head around that.
It's biology. It really is.
It sounds like it, yes, absolutely. So when you talk about pH distortions, what's the normal pH or the healthy pH in our body?
It depends on where.
Oh, so that's not always the same.
It's not the same, right? I mean, you don't want to have the same pH
in
your
stomach.
bladder that you have in your stomach, and vice versa.
Right.
So the pH is different in different areas of the body, different organs, in your joints, at the cellular level. So that's what's great about this, is that it is treating those areas, specifically. And it's just, I use the analogy of a pool or any body of water. You have to maintain proper pH, right? If you have a fishbowl, if it's, if it becomes too alkaline, you're going to have little bacterial growth in there and things start turning green. Same with your swimming pool. So you shock the pool and all of those things drop to the bottom, right? That's kind of what I'm doing with the magnets, is I'm shocking the pool. All the stuff's going to go down. You still have to sweep the sides and vacuum the stuff out before you have clear water. And you usually have to wait a few days, right, for all the chemicals to settle down. But that's your immune system engaging and eliminating whatever it was there.
Wow.
Yeah.
That is fascinating.
It is fascinating. It's a non-invasive treatment. You're fully clothed on the table. It takes about an hour and 15 minutes. The great thing is I'm not looking for anything. I'm just performing the scan and treating what I find.
So you don't actually need to know what discomfort, ailments, diseases people have.
Mm-hmm.
You can pretty much do blind, whoever
Oh yeah, yeah. So that's very different from the acupuncture
Right.
intake, where the acupuncture intake is very detailed, and not only what brings you in, but head to toe. And then I'm going to take pulse and look at your tongue and look at your ear and get all this information for acupuncture. With the biomagnetic pairing therapy, I'm going to do the same scan no matter what.
What are the most common ailments that people come to you for biomagnetic therapy?
For pain, digestive disorders, allergies. A lot of people have diagnoses. Again, it's like, well, you have this. I recently had a lady who had all over whole body joint pain, just constantly. She had blood work done, and her ANA, which is a marker for arthritis, her ANA was positive. So the doctor was referring her to a rheumatologist, and that rheumatologist ordered more blood work. Well, she saw me between blood work number 1 and blood work number 2, and I just did a scan. And when she got her blood work back for the rheumatologist, they canceled her appointment because her ANA was negative. So again, just helping the body to help itself.
How long does that effect last?
It depends on what I find, depends on how long it's been there.
Like
So you think
functional,
about,
yeah.
if you have an area that you've injured your knee, and maybe you had surgery on your knee. So you're done with rehab and everything, your knee's better, but it's not 100%. You know, there's always a little something there. So it just really depends on what I find. And people also have to engage in their lifestyle to correct some of the things, because a lot of times we create our own distortions.
Isn't that the truth?
But what I love about that is Dr. Goiz's take on the genetics of different conditions or diseases, like cardiovascular disease, cancer, that sort of thing, is that the disease itself is not what is passed along. What's passed along genetically is the integrity of the cells. So if it's cardiovascular disease, the cardiovascular cells in the body, that is genetically passed on. Those cells may not be great. It doesn't mean you're going to have cardiovascular disease, but the stage is set.
Right.
So with your lifestyle and the things you do and don't do for yourselves could
Lead, possibly.
more easily lead you down that path. So I like that, because when you think about genetic predispositions, it can be kind of a scary thing. A lot of people think I'm doomed. I think we can take a little more control over our destiny.
Oh, absolutely. I do believe that.
Yeah.
So when somebody comes to you, they just say, listen, I've been to doctors, I've done so many things, and I just still feel stuck. What should I do? Acupuncture or biomagnetic?
That's the benefit of me having a conversation with each person and kind of figuring out where they are. I have people that come to me, they want acupuncture. I had one girl, she just wanted acupuncture. She knows it works. She didn't want cupping, Gua Sha. She didn't want anything but needles. That's what works for her. But she had a history of chronic strep infections, chronic joint pain, and chronic fatigue. And in my mind, I'm thinking, I really need to get the magnets on you. I'll do the needling. We can do that. So, after a few acupuncture sessions, I think she was ready for the magnets. So I think, I take that into account if people don't come to me wanting one thing or the other. And even if they do, I'll make that recommendation based on what's going on with them. Because my lady who had the negative ANA was coming for the magnets, and she does still have a little bit of knee pain and a little shoulder pain. So now she's going to come for acupuncture, and she's not going to be on medication that could cause other symptoms and issues for her. Yeah.
That is huge.
Yeah, it is. It's huge, and people appreciate that. So we've eliminated a lot of the offenders, and now we can shore those areas up.
See, and that's, now we come back to what we said in the beginning. There are so many different tools and pathways to well-being and health out there. Right. So we have to spread the word that this is actually a therapy that's available here now. And
it's a very unique thing, and it's a lot of work for me, but I love it. It's very kind of detective work. So yeah, it goes right along with acupuncture. And Dr. Goiz did present his findings. He went all over the world and collaborated with different people in labs and such. And he sat down in front of one of the premier internal infectious disease doctors in Europe, and he would not talk to him because at that point, Dr. Goiz was not a doctor yet. He said, "You're not my equal. I won't have this conversation with you." So he went back to medical school.
He did?
And he said, "That will never be an issue again." So, and he did present his findings. There are published studies that he has done from the NIH. It's real.
Well, obviously, I mean, you have, since you've been doing it, you have success stories, right?
I do. I have a lot of success stories.
Yeah. Do we really always need that scientific stamp on it, you know, approved?
It's true. I mean, the same with acupuncture. We
Yeah.
finally found a way to study it in an effective, objective way. But, you know, there's no denying that it's a medicine that's been practiced for thousands of years on billions of people all over the world.
Exactly.
So it's effective.
It's effective.
Right.
I mean, the history proved itself there, right? And it's non-invasive, you know, you don't put anything into your body.
Yeah,
That's awesome.
right. With the magnets, they're pretty powerful.
So, I mean, we are in the business of working with people, right?
Yeah.
Mhm.
We are.
And sometimes funny things happen.
Mm-hmm.
Do you have a funny story to share?
You know, what's fun for me is when I'm doing acupuncture and I needle on one side and people ask, did you put a needle over here? Because they feel it on the other side of their body in a different location. So that's always neat. I love when that happens.
I know.
That's pretty fun. My story goes back to when I first started practicing. I was down in Gainesville and I had a lady come in and I did the intake and then, okay, you know, get on the table and lay face up, give her a minute to get on the table. And I step out for a second, collect my thoughts and get myself ready. And I walk back in and she is laying completely naked. I call her my naked starfish lady. She's completely naked like this on the table. And I was, you know, startled. Oh, you didn't have to take everything off. She said, I don't care. Oh no. Well, I don't know. I'm way too new for this. I'm already nervous and now this. Okay. Not that there's anything wrong with the human body. It's just not that kind of treatment.
So do you have anything outside of work that you enjoy doing?
Oh, sure. I mean, so I'm an acupuncturist, I'm an herbalist as well. So I fancy myself a little bit of a green thumb. So I love my plants. When I moved from Tallahassee up here, I couldn't bring all of my plants and I was known for all my plants around the office. And I was going back down there every 2 weeks and they were killing my plants. My office mates were not green thumb kind of people. Anyway, so I was going back every 2 weeks and they're limping along and I couldn't bring all of them with me, but I didn't want to leave them there. So it was very hard for me.
Emotional.
Yes.
Yeah.
But anything on or near the water, we love. And just being outside.
So do you have any plans for this year? Anything you want to start anew?
You know, I think just continuing to grow my practice. You know, I've got a location in Decatur and here in Maine, and I am still driving down to my other office in Valdosta, and I do Biomagnetic Pairing Therapy down in Alachua, Florida. I'm looking forward to really focusing on this area and growing things here. So that's really my focus for this year, is to kind of reclaim some of those hours that I spend in the car, you know,
to actually do the work.
Do the work and have some fun up here and explore a little bit more.
Nice.
Yeah.
Well, have fun. I'm super excited that you're here, and
Well, thank you. I'm excited to be here. I
Good.
really am. I appreciate the opportunity and
absolutely.
love this area, and you know, being here is just it's so comfortable and really feels like a healing space. So I'm really happy to be here.
Oh, thank you.